Thank you, Jag, for being here with us, sharing your experience. You run a community project called Flip Pain in the British healthcare system. Could you tell us how to design a community project?
Absolutely. The first thing you need to ask yourself with a project is, has this research been done before? So you would want to do a literature review and see, what am I adding? What am I giving to people by asking this question? The next thing is, you need to check in with your ethics, because I know it's different everywhere. But don't fear ethics. If you need to submit an application, it's good. It helps you to map a good plan and get a professional eye on the approach you're taking. It's a type of peer review, if you like. Remember, it's a process. It's not personal. And then you need to advertise. Let's tell people what we're doing. Let's get them involved. And then plan a venue. Provide refreshments. Make it a really valuable experience. Then you need to decide, are you going to collect data? Are you going to publish this? So you might want to collect baseline data. Ask, what do you know? What outcome measures are you interested in? Is it disability? So what are you able to do on a daily basis? I like the MSK-HQ questionnaire, but you might use a different one. And then you would deliver your intervention or your community care, as one of our colleagues likes to call it. And you then may decide, I want to deliver more than one session. If we use an example, pain science education, you may just want to do one intervention, collect the data afterwards, and then collect it again at 3 months or 12 months to see if people have kept the information that you've given them. If you're going to do something bigger, like an exercise program, you need to decide how many repetitions you're going to do of the intervention and why. Justify it using the data that's out there. And then, so you might have another period of data collection. Whatever you do, stay in touch with your community and your patients. Keep talking to them, keep them involved. Maybe have an email newsletter or a WhatsApp group or something so that they know what's going on. Does that help to answer your question?
Yeah, sure. But can a physio lead a community project?
Definitely. Physios are really well placed to lead community projects. We see patients, we see needs in the community. But a really good idea is to get other people involved as well. Don't take all that pressure yourself if you don't need to. So you might choose to use or engage a doctor who's fed up with seeing lots of people with chronic pain, and you might then measure, is the doctor seeing less people for chronic pain management? You might also involve respected community leaders who would be able to encourage recruitment and the retention of your participants. Does that answer your question?
Sure. What kind of a strategy would you advise?
Sorry, can you...
What kind of a strategy would you advise?
As I'd said, I would start with ethics, start with knowing where the gaps are in the literature, and then start a campaign of recruitment. So you will already have identified your inclusion and exclusion criteria. Who do you want to be in the study? And then once you've delivered your intervention, obviously collect your data and decide what you want to do with that data. Do you want to publish it? Do you just want to use it for internal communications? That's something you must have in mind from the beginning.
How do you plan it, and how do I get the funds?
Funding. How much money do you need? Ask yourself. Try and keep it cheap. So ask yourself, what do I need money for? Is it for promotion? Speak to radio stations. Maybe somebody would be happy to do some advertising for you because it's a community project. Speak to shop owners. Speak to religious venues, schools, community venues, and they might be willing to, if you email them some advertisements, maybe they're willing to send them out for you, disseminate them for you. where will you do your intervention? Will it be in a community space? If it's in a community space, it's easier for people to get to, and there may be no cost or very little cost. Also, you might try to apply for funding from physiotherapy organisations that want to encourage people to be in research, or other health organisations. There may be some EU funding for small pots of money. It's definitely worth trying. And then if you can, get local companies involved, see if they can support a little bit.
I think you've already talked about it, but what data should I collect?
Easy. What are you interested in? Find out, is it disability? Is it pain? Is it knowledge? Is it attitudes? Is it activities of daily living? Is it the number of times people go to the doctor? Identify those things and then make sure that the outcome measure you use is one that's been tested. Because certainly if you're publishing, you want to be able to compare to other work. If you have a good, sound evidence base and plan to work from, your findings will be easier to defend.
Thank you very much. Your experience helps us a lot. Thank you.
It's a pleasure. Thank you. Thank you.